on my page. You probably are wondering who I am and what makes me an authority to teach about health, wellness, and fitness. Let me start off by saying my name is Allison, and thank you for coming to my page. You may know me because most of my followers are friends and family right now. But I kind of wanted to give some background and let people know why I'm here, why I'm doing this, and how this all came to be. In 2010, I became a NASM certified personal trainer. I've always had a passion for fitness and I've always been an athlete. But that does not make me qualified to help others in reaching their goals and kind of helping them recover from injury. So I decided to abandon being a personal trainer and start my career as a physical therapist assistant. I started in 2015. I started working for NovaCare, and I was also going to school full-time to get my bachelor's in science and health sciences. So I continued my education from a certified personal trainer to a physical therapist assistant, and then rounded it off as a bachelor's degree in health sciences. I took a lot of classes in continuing educations for a wide variety of patients because I treated everything in outpatient. I worked with student athletes, I worked with high school athletes, former NFL linemen, I worked with pediatric cases, amputees, diabetics, people trying to lose weight so they could have surgery, post-op, of course, and just general back pain from everyday life and sitting around all day. I kept on seeing gaps though. So as a personal trainer, I saw gaps from people returning from injury and not quite getting back to their previous level of health. Either they weren't able to stay committed or they weren't happy with the physical therapy they were receiving. As a physical therapist assistant, I started seeing insurance costs skyrocket and people just could not afford it anymore. Or we had to cut time that we could spend one-on-one with our patients to kind of cram our schedule to make our days more profitable. So I spent a lot of time educating my patients on independency, on taping, stretching, soft tissue mobilization on their own, myofascial release, and I saw a lot of benefit from that. But I really wanted to help my patients get to 100%, and I wasn't seeing that. So every spot I've been seeing gaps, and my goal with my page and my content and this big picture that I'm building here is to help fill the gaps from health and wellness to fun fitness that people actually enjoy, and making sure that we stay injury and pain free. So as we do this, it's kind of going to be a slow build, so please stay with me in my process. I do have 2 kids. I do have a dog, so sometimes my content might be interrupted, and I do apologize for that. A little bit more background on me. Not only was I a certified personal trainer, but I was also a strength and conditioning coach for Roosevelt University, softball and volleyball. I helped develop summer programs, in-season conditioning and post-season conditioning, strength training, sport-specific designed programs to help these athletes transition from high school athletes to the college level that they needed to compete at. From there, and becoming a physical therapist assistant, I also enjoyed writing fitness articles because I wanted to bridge that gap. It's not just about the health side and getting better from injury, but it's also about taking care of our overall wellness. I've worked all around the Chicagoland area and I really enjoyed it. I also, like I said, have 2 kids, so what you see today has been abused through 2 pregnancies, gestational diabetes, and everyday life. So what I do is probably not going to fit just you and what your goals are, but I want to be your coach. I want to help you through the hard times, and I want to make sure that you're enjoying fitness. My workouts are 60 minutes long. We don't have to start there. Let's start with 20 minute workouts 2 times a week, maybe 3 times. Forming a habit, yes, takes about 2 months. But there's something called general adaptation syndrome, which takes 1 to 2 weeks. So your body adjusts to working out in just 2 weeks. So all I'm asking for is to give fitness a try. Let's work through your injuries together. And if you take a look at my Instagram page, right now I have highlights of content for my stories. And currently it's focusing on core stabilization, older adult training, full body training, and beginner exercises, as well as fun fitness facts and other things that can help you along your fitness journey. Like I said, I'm new to this, so I do apologize. I haven't had to do public speaking in a while, but I appreciate you guys coming to my page and being here for me so I can be here for you guys. I really enjoy helping others become healthier and enjoying fitness, and I want to make fitness enjoyable and attainable. It doesn't have to be long endurance workouts. That's what my body likes. That's what I thrive in. It's kind of like a mental health thing. So coming soon, I will be having highlights and stories and content about pregnancy and postpartum and how to work back into that. Pelvic floor exercises, because both men and women and even teenagers need to work on their baseline core stabilization. Pre-surgery checklist, total knee replacements, going in for shoulder surgeries. When you're in pain, what can we do to help you not be in as much pain going into surgery, and how to optimize your outcome coming out of it? So again, I really appreciate you guys being here for the beginning of my journey, and thank you so much for taking time out of your day to watch this video.